Like Gold mentioned in her story, the CAHOOTS program may be making a comeback in Eugene thanks to a portion of that new budget. Tiffany, can you elaborate on that funding?
Of course, Kendall. Well, there's still a long way to go to revive CAHOOTS completely in Eugene. As mentioned, $500,000 was set aside to transition alternative crisis response within the city's budget, but that's not even close to what CAHOOTS once operated on. And advocates say it's nowhere near what's needed to rebuild a crisis services model from the ground up. Before CAHOOTS stopped operating in Eugene this April, the city covered 40% of its budget. Whitebird Clinic was unable to fund the remaining amount and laid off 80% of its CAHOOTS staff. Now, a startup nonprofit called Willamette Valley Crisis Care, a group of former and current CAHOOTS employees, are now working to recreate CAHOOTS' services, but completely separate from their former company, Whitebird Clinic. The nonprofit plans to find new sources of funding to support CAHOOTS and plans to leverage their decades of experience to accomplish this.
Willamette Valley Crisis Care's overarching vision is to be able to bring a continuum of crisis services to the community. So although our main focus has been on the former and current CAHOOTS workers that want to bring the mobile integrative healthcare piece back, the vans, back to the road, we're hoping that this actually gives us an opportunity to bring a larger grouping of services that we have not been able to expand in the past, including education, consulting, training.
Michelle Perrin says WVCC just approved their board members and are moving toward fiscal stability. Lane County says once they're up and running, WVCC will be eligible for state funding and welcomed as another provider that can provide services to vulnerable community members. Meanwhile, Whitebird Clinic says they still intend to bring CAHOOTS back to Eugene. We'll be following up with them on Wednesday to learn more. The City Council also directed the city manager to investigate how to relaunch a CAHOOTS-like program for crisis response at an estimated cost of $2.2 million a year. WVCC says they hope to be involved in that investigation and secure funding for their program.